Welcome to Health Talk. I'm Christy Money, health educator with the Caldwell County Health Department, here with Chio Vang, also health educator, preparedness coordinator for the Caldwell County Health Department.
Alrighty, so this month is February. It is Children's Dental Health Month. So among children ages 6 to 8 years old, over 52% have a cavity in their baby teeth, right? So children 12 to 19, more than half, 57%, have a cavity in their permanent teeth. So today we are going to discuss how to prevent cavities, decay specifically. So Christy here, she has a background in dental. She's been in that field for 25 years now. And currently she is a health educator today. She's going to educate us on tooth decay. So my very first question to her is, what is tooth decay?
China, tooth decay is damage to a tooth surface. Most people, of course, recognize that as being a cavity. A cavity happens when there's bacteria that's left in your mouth, and it makes acids that attack your enamel, which lead, of course, to decay to cavities. If tooth decay is not treated, that can cause pain, infection, and even tooth loss.
Awesome. So it's not good to have tooth decay,
No.
essentially. My second question to you is, how do parents help prevent their kids from getting tooth decay?
So tooth decay is very preventable. It's crazy to me that over half of kids have a cavity.
Wow.
Because it's so preventable. Of course, the way to do that is to keep your child's teeth healthy. Start good dental habits early. Even if they don't have teeth, as a baby, take a washcloth and wipe their gums. Just get used to being in their mouths. And of course, keeping the kids' teeth clean as they start to get teeth. Brush twice a day with a fluoride toothpaste, and a floss every day, of course. Kids, you'll have to help them brush their teeth until they're about age 8 because they just don't have the dexterity to be able to get them really clean. It's good to let them have the toothbrush, let them brush their teeth so they learn, but then you go back and brush their teeth afterwards.
Gotcha.
That way you're making sure that their teeth are clean.
Awesome. So you talked about activities and making it a habit of being in your kid's mouth so that way they get used to it. What kind of activities do you encourage a healthy mouth and teeth?
Of course, don't let your baby go to bed with a bottle. That's very important. If they do go to bed with a bottle or a sippy cup, just put water in it. Limit sugar sweetened beverages, soft drinks, of course. Kids love those.
Yeah.
And of course, milk. Some flavored milks, if they have sugar, apple juice, any kind of juice drink, they all have sugar. The sports drinks, the Gatorades. If they have them, try to let them drink through a straw. Sometimes they say that helps. It kind of helps bypass the teeth. The soda's not sitting there on their teeth. And then, of course, after they have one of those beverages, have them to brush their teeth afterwards.
Awesome. At what age should a child start seeing a dentist?
The American Academy of Pediatrics recommends the first tooth.
First tooth.
So whenever they get their first tooth, take them to the dentist. Some people are kind of whatever with that, like, seriously, you're going to take my baby to the dentist, they only have one tooth.
Yeah.
But definitely by the first birthday, if they haven't been whenever they've gotten their first tooth. And that's another thing, it's just helping the kid get used to being at the dentist, getting used to, the dentist looking at their teeth. They may not necessarily clean their teeth at that age. It may just be that they're laying there and they have an exam, which is fine. At least the dentist is checking their teeth, making sure that everything's okay and that they're not having any problems. The last time I took my granddaughter to the dentist, I actually laid in the chair with her.
Oh, wow.
And she laid on top of me, and the dentist, checked her teeth. But that was just getting her used to, being in that position, the dentist being there, and she did great. People are afraid, of course, that their kids are going to pitch a fit or whatever, and if they do, oh well.
Yeah.
Like, the dentist is used to it. If they see kids, of course kids are going to cry and whatever. But just having that routine of going back every 6 months with them, that just gets them used to the dentist themselves. It gets them used to being in the chair, gets them used to having that exam. So, of course, you want to keep doing that.
Awesome. Yeah, and creating that habit of, seeing the dentist every month or every 6 months, sorry.
Yes.
So dentists typically recommend sealants for children. What kind of sealants do you recommend?
Okay, so sealants, I'm going to tell you a little bit about them. They're like a plastic coating on your teeth. They are going to cover the top part of the teeth that whenever you brush, you're not getting into the tooth. So we actually tell kids a lot of times it's like painting your fingernails.
Gotcha.
So all it is like a little paintbrush, and they just paint something on their teeth, and they use a little light that makes it dry. So that covers that surface and it makes it more smooth, whereas it doesn't have the little rough edges down in there. It makes it smooth, so when they're brushing their teeth, of course, they can get all the food, and all that stuff out.
Gotcha.
Super easy. You don't have to be numb for that. That's just a simple procedure. You know, it depends on how many teeth they're going to seal. I mean, it could take up to 30 minutes, but so easy to do, and so good for the kids to have their molars sealed. And the sealants, they last, of course it varies, but I mean, many years typically. They can last, 5-6 years. They could last 20 plus years.
Oh, wow.
You just never know.
You just never know.
But if one of them was to come out when the dentist checks, they check for that, of course. They can just go back and reapply that. That's something super simple to do.
Awesome. I'm just shocked that it could last up to 20 years. That is crazy.
Yes.
So, knowing that me and you both work for the health department, we also do have a dental clinic. Could you give us a little bit more information on our dental clinic?
Yes, our dental clinic is amazing. We've got Dr. Janelle there, who is an awesome dentist, and she does anything a regular dentist would do. She does fillings, she does cleaning, she does extractions, and of course she does sealants. That's her big thing. In the dental clinic, they see kids ages 0 to 19, so from the first tooth up until age 19. The children do have to be on Medicaid for them to see them. So yeah, our dental clinic's awesome.
Yeah. So come see our dental clinic if you have children. So overall, to care for your children's teeth, you should eat well, lots of fruits and vegetables, and avoid a lot of sugar, of course. And be sure to brush your teeth twice a day, floss daily, and teach your children how to properly care for their teeth, and do it for them until they can properly do it, right? So if you want to have an appointment with our dental clinic today, you can contact us at 828-426-8525. Again, that is 828-426-8525 to schedule an appointment. Thank you, everybody, for tuning in to our monthly health TV talk. I hope everybody has a good day. Thank you.